All right, I think we can go ahead and get started. So thank you so much for joining us today. I'm Lauren Steenson. I'm the Grassroots Advocacy Intern for Shot at Life. And really the point of this refresher is just, we know that so many of our champions have been with us for a few years now, which is great, but it may have been a few years since the last time you saw this training. And there's been a lot of new information since then, especially like regarding our diseases and the pandemic. So we just want to give you a little refresher on some statistics and important information to keep in mind going into your meetings and going into Mobilize to Immunize. And we also want to share some exciting news about the impact that our champions advocacy has had. So we will share all of that with you in this refresher training today. So I see many of you are using the chat. Love that. Feel free to put in where you're coming from, how long you've been a champion. We would love for you all to get to know each other a bit more, especially since this group, you probably have already seen each other at some of our events since you are all returning champions. So feel free to put anything in the chat. Also, if you have any questions at any point during this session, feel free to put your question in the chat and Allie will respond to you. All right, so I think with that, we're going to go ahead and get started. So first of all, this is our grassroots team. So you all are champions, so you've probably already met Allie and Rebecca, but just a reminder of their emails. And if you ever have any just general questions, you can email the champions@shotatlife.org. So that's if you have a question about advocacy or if you want to let us know what you're doing, you can just email that address and someone will get back to you soon. So just a little overview to start. We're going to talk about the impact that our champions have had. So some statistics on what we've been able to accomplish in this decade of Shot at Life being around. We'll have some information on global immunization programs, especially because there's been new developments with how COVID has affected our work. And then we're going to talk a little bit about our partners and what they're doing. And then finally, we'll talk about the federal budget and appropriations. All right, so first off, we're just going to go and talk about the impact of our champions. So you guys have successfully advocated for global immunization programs this past decade. So we just want to take the time to thank you so much for your advocacy and highlight some of your accomplishments. So since Shot at Life's inception, we've had over 2,400 in-person meetings with members of Congress, and we've sent almost 225 or 27,000 letters to members of Congress. And so this has resulted in an estimated 225 million increase for global childhood immunizations in the federal budget. So that has been done with our partners, but we know that our champions advocacy has clearly made a real difference in securing funding for global immunization programs. So again, thank you for all of your amazing work. And I just wanted to share this graphic with you guys. As you can see, so since Shot at Life started, every year we have either increased how much spending has gone toward global immunization programs, or we've been able, when the budget got cut, we were able to secure our funding. So that's a really big accomplishment and we're very proud of it. And then here are our accomplishments from our most recent activation in the spring, Advocate to Vaccinate, which I'm sure many of you were a part of. So you can see what we were able to achieve and that we exceeded all of our goals. And we're really looking forward to Mobilize to Immunize and exceeding our goals again with your help. And like I said, Shot at Life has now been around for 10 years. So we're really excited to share some of our numbers from those 10 years. So you can see here how many lives we've saved and money we've secured. And we're really happy with that. And yeah, we're just so grateful that we've been around for a decade and we've had your support for that time. So thank you. All right, so now I'm just going to give a little reminder on some of the global health stuff, so we can brush up on that and you'll feel a little more prepared and ready going into your meetings this fall. So just a reminder, you've probably seen this before, but the SDGs, and we focus on SDG 3. So that's good health and well-being, but we do touch on a lot of other SDGs. And if you want to learn more about the intersection of the SDGs, we have a blog series that you can read about. And yeah, so we're working toward accomplishing this SDG with the help of our partners. So the problem is that 1.5 million children still die of vaccine-preventable diseases every year. And one of the biggest stumbling blocks to the health of children under 5 is access. And due to social and geographical exclusion, insufficient resources, weak health systems, and in-country conflicts, 1 in 5 children can't receive the vaccines they need. And then without those vaccines, children living in the world's poorest places don't have the same leg up on life that those who are vaccinated do. So instead of building friendships and learning about the world around them, they may be fighting vaccine-preventable illnesses. But the good thing is that there is a solution, and that is access. And access to vaccines has grown significantly in the last decade, and we know that they're the most cost-effective way to save the lives of children. And they currently help save 4 million children from preventable diseases every year. So there have been some challenges recently, though, especially with the pandemic. So according to the WHO, global vaccine coverage remains at a constant 85% in the past few years, which means that 19.7 million infants did not receive vaccinations in 2019. And then on this next slide, I'll show you some more pandemic-specific stats. So as you can read here, coverage dropped to levels last seen in the 1990s. So we've been set back about 25 years and 25 weeks in terms of vaccine coverage. So it's led to a major backsliding on childhood vaccination. So like 23 million children missed out on basic childhood vaccines through routine health services in 2020. And that's the highest number since 2009. So because of all of this backsliding, we need to work extra hard to protect the progress that we've made and ensure that coverage stays high moving forward. And then here's just a little graph to show you of the progress we've made with our partners. So as you can see, child deaths is on the decline, which is great, and we hope to continue that downward trend. So again, you guys are probably familiar with our key diseases, but we just wanted to remind you of them, especially because we've got big moments for World Polio Day and World Pneumonia Day coming up. So I'll just give you a little information on like what those diseases are. So first up, we've got measles. It's the most contagious, one of the most contagious and infectious diseases, and it spreads through coughing and sneezing. And 90% of unimmunized people who come into contact with an infected person will catch measles. It's treatable in the US, but it can be deadly in places that don't have quality medical care, sanitation, or nutrition. And despite a lot of progress, measles still kills an estimated 415 people each day, and the majority of those are young children. We also have polio. So polio attacks a child's nervous system and can cause muscle weakness, paralysis, or even death. Thanks to polio vaccinations, 5 million people who would otherwise be paralyzed are walking, and polio cases are down 99%. So never before has the world been this close to eradicating polio, but the disease has recently reemerged in areas that had been polio-free for years. And until it's permanently eradicated, polio anywhere remains a real threat to children everywhere. Then we have diarrheal disease. So it's the most common cause of severe diarrhea among infants and young children. It can be so deadly that it causes severe and even life-threatening dehydration. And each year, more than 500,000 children under the age of 5 die as a result of rotavirus, and almost 2 million more become severely ill. And then finally, we have pneumonia. It's a bacterial disease that can cause meningitis, and pneumonia, it's prevented by a vaccine, and that's the only way you can protect children from it. So here is our coverage of those diseases that I just mentioned to you. So you can just read those again. You don't need to memorize any of these statistics. We are just wanting to show these to you so that you can get a better idea of where we're at in terms of our diseases right now. Yeah. So who we advocate for. So as you all probably know, we do not directly administer vaccines anywhere in the world, but we work closely with the World Health Organization, Unicef, Gabby, the Vaccine Alliance, and the CDC and USAID to support vaccine access in different ways. So we have the World Health Organization. They coordinate international health within the United Nations system. And in low-income countries, they have an extremely important role in making sure that UN programs are coordinated with local ministries of health. Unicef is another big one. They are a vital organization that helps deliver vaccines around the world. They're also the largest buyer of childhood vaccines, and they reach over 45% of the world's children. And in 2020, Unicef procured 1.9 billion vaccine doses for children in 102 countries. They also manage the cold chain system, which some of you may know about, but it's basically just a refrigeration system that keeps vaccines at the proper temperature as they move through hard-to-reach corners of the world. And they're also on the ground educating families about vaccines and encouraging them to get their children vaccinated. So they're a very, very important partner to us. So then we have Gabby, the Vaccine Alliance. So Gabby is a public-private partnership that works with the world's poorest countries to ensure that they have access to vaccines. And they do that by pooling funds from low-income countries that cannot contribute the full cost of a vaccination. And they pool that with funds from donors and other high-income countries. So they pool demand so that they can negotiate lower vaccine prices by buying in bulk. I like to think of it as the Costco of vaccines. And they help deliver vaccines against 17 infectious diseases for children in the world's poorest countries. And since 2000, they have helped immunize more than 760 million children, saving 13 million lives. And low-income countries who benefit from Gavi must always contribute a fraction of the vaccine price, which ensures that they have ownership in the program. So we also have the CDC, which of course you've heard about, especially with the pandemic. So a lot of people think that the CDC just does stuff with, here at home in the United States, but they also work to prevent, detect, and respond to infectious diseases in the US and abroad. They provide low-income countries with scientific and technical support to control vaccine preventable diseases around the world. And they lead many global health security efforts like the Global Health Security Agenda by working directly with partner country governments to strengthen public health systems and reduce the risk of infectious disease outbreaks. And then finally, we have the U.S. Agency for International Development, also known as USAID. They support countries to develop sound immunization policies, strategies, and guidelines. And they also improve our global health security by preventing and responding to diseases overseas so that they don't spread to the United States. And they're saving lives by improving public health education, protecting healthcare facilities, increasing laboratories, disease surveillance, and rapid response capacity in more than 120 countries. And then some of you may have seen this graphic before, but this is the vaccine journey. So it shows that the path that our vaccines take with our implementing partners. So for example, funds would be granted to UNICEF, and then they are in the factory, and then UNICEF helps transport them to where they need to go. And then all of our partners work together on the ground to help make sure they get to where they need to go. So the World Health Organization and CDC work with local ministries of health and coordinate there. And then UNICEF is really the big one that transports them through the cold chain system, like I told you about. And then they're also educating families so that their children get vaccinated when they have the opportunity to do so. All right. So now we've got the federal budget. So you guys have probably seen this before in our training, but we really just want to drive home how little of our budget is spent on vaccines and immunization programs. So when you're in your meetings and you're saying these big numbers that are in the hundreds of millions of dollars, it may seem like you're asking for a lot, but in the grand scheme of things, it's really not that much. So as you can see here, out of our federal budget, we only spend about 1% on international affairs. And then of that 1% on international affairs, we spend 20% on global health. And then of that 20%, we spend about 6.4% on vaccines. So we are asking for a fraction of a fraction of a fraction of the budget. So I just think that's really helpful going into your congressional meetings to keep that in mind and know that we're really not asking for too much here. So hopefully whoever you're meeting with is aware of that and you can also bring it up. So now we're going to talk about the committees that decide these numbers. So I'm sure many of you know this, but the committees that are most important to us are Labor, Health and Human Services, and then State Foreign Operations, also known as SFOPs. But just because a member of Congress doesn't sit on one of these committees, it does not mean that they're not important to us. There are other ways that they can support us. They can support us by, advocating to us to their fellow members of Congress, writing op-eds, and just having their support in general is really helpful to us. So these are our fiscal year 22 asks. So if you advocated with us in the spring with Advocate to Vaccinate, you probably already saw these, but just a little refresher. Again, you don't have to have any of these memorized. We'll give you the talking points before your meetings, but just want to give you a little refresher on what those are, especially going into the fall. And that is it. So thank you so much, everyone, for joining. If anyone has any questions, please put them in the chat. And yeah, I think that's about it. I mean, I know that so many of you are already familiar with this information, but again, we just wanted to refresh you all. There's been some updates, and we look forward to, working with you this fall. And we are really excited about our kickoff tonight at 7 p.m. Eastern. We encourage you to join us for that. We're going to have some great speakers, including Dr. Peter Hotez, who is a renowned scientist. So please come back here at 7 p.m. for that. And let me know if you have any questions. Otherwise, we will see you again tonight.